X-ray, Sierra Charlie Oscar is ready for departure, runway 05.
Wind 230 degrees, 10 knots, runway 05, clear for takeoff.
Clear for takeoff, runway 05, Sierra Charlie Oscar.
So on board with me today, I've got, apart from a plane load full of passengers, I've also got Kai Daniels, and Kai works with Partners in Health. Now, Kai, you were telling me before what Partners in Health do. Perhaps you can tell me again some of the things that Partners in Health do generally, and then maybe more specifically in Liberia.
Sure. So we work to accompany the Ministry of Health in the 10 different countries we work in to embed ourselves within government facilities to strengthen care. And we're working at several levels. So at the community, with community health workers working to refer to health centers, and then further on up to the hospital to provide the full spectrum of care. We're really striving towards universal health coverage. So everything that a patient could need, we want to prepare the system and strengthen the system to be able to provide. So here in Liberia, we came in at the request of the government to support with the Ebola response. And they asked us to come to the southeast as a region that's been historically underserved, as you know really well. And we're not an emergency response organization, but we said we'd be more than happy to support, but that we wanted to commit to staying, because we think the Ebola response is an example of how weak the healthcare system is and how it needs to be strengthened. And so after the crisis, we kind of settled down in Maryland to start working with the Ministry of Health to strengthen the healthcare system in the whole county, and ultimately the hospital we're working at, J.J. Dawson, is a referral hospital for the 500,000 people living in all of Southeast Liberia. And we're working to provide the full continuum of care, right? So we're working on maternal health, we're working with mental health, we have a surgeon, we have HIV patients, we have multi-drug resistant tuberculosis patients. So we helped build the ward at the hospital. It's the only other place to get drug resistant TB treatment outside of the capital, Monrovia. And this is, I think, where we couldn't do the work we do without math.
Right, because I flew some TB medicine down last week. Yeah. I saw that it was written on the side, tuberculosis medicine, and that's the one you were talking about.
Yeah, exactly. Right. And I think part of the challenge of working in the Southeast with the road conditions the way they are, on the best days, it would take 2 days to drive here and get those drugs here. In the rainy season, like it is for more than half the year, maybe it would take 4 days, maybe it would take a week, or like how it is right now, we're not running our shuttle because we don't, our road shuttle, because we don't think it's safe enough to be sending. It's and so then those drugs that you brought last week would be stuck in Monrovia indefinitely, and in Maryland there would be a stock out for some time.
So MAFA helping you in that way. So we're able to get things down for you that you wouldn't be able to get otherwise, and including flying yourself down there and other workers.
Our clinicians, and not just that, like on board today, there's a patient with us, right, and he's going to Monrovia and being referred there. So whether it's medications or the doctors coming themselves or patients being referred for their care, we just couldn't. I don't know. We're essential partners. I think we couldn't do the work we do in the Southeast without aviation support.
Yeah, that's great.
Up traffic 5 X-ray, Sierra Charlie Oscar, 2 miles inbound from Spriggs through 2000 on descent. Upper at 1030.
We're incredibly lucky to have MAF as a partner. before MAP was here, we were working with the UN, but now that the UN mission has pulled out, there's no domestic airline, of course, even, and we utilize the road as much as possible, but when it's impassable like it is now, it's just the only way is by air.
Right. Well, we love doing it. We're very happy to do it.
We're very grateful.
Yeah, good. All right. Well, I guess I better get back to flying the airplane.